Hi, my name is Alex. I'll be conducting your interview today. Nice to meet you, Nav.
Nice to meet you as well, Alex.
All right, let's get started. Please tell me a little bit about yourself.
So I am a first generation American. My parents came to America from India, and I got my bachelor's of science in biology from the University of Nebraska, and I'm currently getting my master's of biomedical sciences at ATSU. And my introduction to medicine actually happened within my family. Both of my parents worked in healthcare in a way. My dad worked at a veterinary clinic. My mom was a nurse at a clinic at the time when I was a kid. And the clinic was both close to my school. So after school, I'd walk to the clinic and I would hang out back there. And I would just hang out with my mom till she got off work and just hang out with all the nurses, the physicians, the PAs, the MAs, anyone I could. And I kind of just found myself imitating them as the time went by. It was a colonoscopy clinic, and so I remember one of the questions they would always ask was, the patients was, have you been fasting? I had no idea what fasting meant at the time as a younger child, but I remember just going around just asking people, random people that worked there, just, have you been fasting today? And they would just laugh. And if I found a stethoscope or found something I could put on, I would slowly, just play the role. And as I grew up, I started building a passion for it. Working as a MA, working as a research associate, and then as a clinical research coordinator. And I actually had the opportunity to work during the pandemic and was part of a few clinical trials in which, when the chaos was happening, we were using, learning about various medications. And my passion for medicine just grew even more. Not only in the aspect of helping people, but in the educational aspect of learning about how important research to medicine is as well.
Oh, thank you for that answer. Why do you want to go into medicine?
So, like I stated before, my passion happened from my various clinical experiences. Yes, I was introduced through my family, but those clinical experiences what really made me fall in love with medicine. And it was what brought me to the profession of PA was actually someone who I worked with, or actually, I'm sorry, who was a PA of mine. I was someone who unfortunately got hurt a lot playing sports, ankle injuries, knee injuries, wrist injuries, you name it. I'm currently on my longest stint in life of 2 years of without an injury. And I thankfully had the same PA who was able to see me. And he really helped me not only um, in the treatment, but also emotionally. And guiding me, and he helped me feel seen. He talked to me as a person. I felt more than just a patient to him. I felt like he was going out of his way to check up on me and really relate to me and spend time with me during our clinical visits. And I want my patients to feel how he made me feel, and that was seen. And since then, my drive for medicine has only grown.
That's very inspiring. Thank you. So, why do you want to become a PA and not a nurse practitioner or a doctor?
Well, I believe the PA profession brings the best way I can help patients personally. It allows me to interact with patients more at a deeper level, and it helps me reduce the gap of uh, providers needed in this country. I have seen how long it's taken at times for patients to get access to physicians, to get access to any provider, may that be. And there's a large gap that's facing this country. I mean, there was, unfortunately, my aunt was diagnosed with breast cancer, and it was during the pandemic, and she couldn't get her first appointment for almost 3 months just because there was a lack of it. And I've seen that not only here in this country, but in Canada and in India. We're going there and speaking with nurses, speaking with other physicians in these various countries. I've seen the lack that is not only in the US, but throughout the world. And I want to help bridge that gap in medicine.
Yeah. Let's move on from what got you into medicine and what happens when you encounter a hurdle. For example, what if you couldn't get into PA school? What would you do?
Well, I have actually been applying to PA school for 2 times now, and this will be my third cycle. And I haven't gotten in yet, but it hasn't deterred me. For me, PA school is there is no plan B. PA school is the plan A, and that's the only plan. And that is the reason why I enrolled into the master program at ATSU, and I have been thriving in it. Earlier in my education, I had some gaps that led to a lower GPA, but that has not deterred me. I am doing well in my master's program, and I'm continuing to build clinical experience. And mainly it's been focusing on research because I do want to have an educational role as a PA. After finishing PA school, I want to get my doctorates of medicine in PA studies because I want to be a PA who is able to run his own clinical researches. I know I've seen the benefit firsthand of patients being able to participate in clinical trials and as observational studies. I mean, we saw in the pandemic, the reason we had so much access to the virus was we had years of observational studies that had studied it. And so I want to build in that aspect as well.
Great, thank you. Why don't you tell me about a memorable patient interaction?
A memorable patient interaction I have had was there was one time we had a patient who was at the gastrology clinic. This was the time I was working as an MA, and the patient had dementia, and she would forget where she was at the time, and she actually thought I was her son a few times. And I was one of the younger ones who I was working there, and she was getting flustered because she would lose where she was. And, at post-op, patients can kind of become a little disoriented. And I just remember her telling me, "I'm glad you're here." And those simple words, just the simple act of kindness that she was telling me, even though, I was just doing my job, but I remember those words for a long time because it felt like I was doing more than just treating her. I was being there for her, a person, and I could feel that I was allowing her to be seen. And I mean, that's what brought me to medicine. Like I said earlier, that PA had me feel seen. And so knowing that I had done that for a patient is something that I've held closely.
Great, thank you. How do you use your communication skills in group settings?
I like using my communication skills with just allowing everyone to be heard and being able to give them a platform to speak. In my clinical experiences as a clinical research coordinator, you work with the various providers who have their own clinical studies. You work with PAs, nurses, research managers, PhD students, and you all have to work as a team. And communication is really important. And in that setting, I would make sure I was speaking to each individual, but also bringing every individual together and allowing their opinions to be shared. And I would manage these by either through Zoom or if it was possible, we could meet up person or even do smaller meetings between people. But I wanted to make sure that everyone's ideas were brought to the table and communicating that I wanted to hear those ideas from them and communicating my own ideas. And medicine it takes a team effort from the receptionist that says hello to the patient to the last person that the patient sees. And I believe communication is vital. And communication, I've seen how a lack of communication has affected medicine as well, through my own clinical experiences.
Thank you. Next question. If you had a patient with a language barrier, how would you assist that patient?
So, we had to deal with this a few times. And something we have used is speaking. The patient was Spanish speaking, and we had a interpreter that you would speak through the phone, and you would say the questions you had. But while that is a possible tool, I personally like to have a person who can actually be there. So if I have a coworker or a peer who is there, who is able to speak the language, I would like them to come in. I believe patients are able to interact more openly when they have an actual person there who speaks the language. My grandparents don't speak English at all, and so they would take me with them to speak the language. And I was a little kid, so I was trying to translate to the provider as much as I could. But I could tell that they were not being as open because I was still a younger kid and they didn't want to say certain things. And I've seen how open they have been when the provider they're speaking with does speak their language. It improves their health literacy and it builds a greater communication because it allows the patient to feel comfortable and I think it builds trust between provider and patient. So, if possible, I would like to bring a medical professional into the room who can speak the language.
Thank you. All right, moving on. What do you do in your spare time outside of medicine?
I am a very active person. I love working out and playing basketball, especially. I would like to read more. I've been trying. A recent book I read was When Breath Becomes Air. But majority of the time, I do like to spend being outside. I enjoy playing any sport that I can get into. Unfortunately, that's caused a lot of injuries in my life, but sports has brought me to medicine, and which I truly passionate for. Otherwise than that, I usually am just studying. So it's either outside or I'm studying medicine.
Great, thank you. As we conclude, do you have any questions for me?
Yes, I actually do have one question. When I was researching about your program, something that stuck out to me was a mentioning of a co-curricular activities that you described that enlighten and inspire. So I was wondering if you could elaborate on those activities and what feedback have you gotten from previous cohorts about these activities?
Thank you for that question. I'll start with the first part about what activities enlighten and inspire. So Oz, the ATSU mission statement is to expand access to care. For our Central Coast Physician Assistant Program, we do connect specifically for our rotations to be, our sites to be at community health centers. And community health centers, the definition are funded healthcare centers that focus on medically underserved individuals. So people with no insurance or very high deductibles can go to a community health center and receive quality care. And in that way, we inspire and expand access to healthcare. To answer the second part of your question about personal connections, we do that through students engaging with each other and collaborating in group settings to work on their work, and then also providing services at our school, such as the Writing Center, and we have librarians to help with research projects. And through these different avenues, we try to support our patient or our students as the best that we can.
Well, thank you very much for that answer.
All right. I hope that helps, and it's been very nice to interview today. I hope you have a good rest of your day now.
You as well, Alex. Thank you very much.
Thank you.